All right. Good morning, everyone. While we're waiting for the slides to come up, I'll introduce myself again. My name is Marisa Scala-Foley. I direct something called the Aging and Disability Business Institute at the National Association of Area Agencies on Aging. And these are actually not my slides. I'm not a doctor and I don't even play one on TV, but I can tell you a little bit about what we do, which is really, our mission is to do exactly the work that AJ is talking about, which is to build the capacity of community-based aging and disability organizations, there we are, to partner and contract with healthcare entities so that older adults and persons with disabilities can live at home in their communities for as long as possible. We are funded by the John A. Hartford Foundation, the SCAN Foundation, and ACE, and the Administration for Community Living, which is where I actually used to work at the time when the discussions were going on about the accountable health communities. And they were interesting, let's just say, particularly related to that provision that you talked about in terms of no funding for the services that can actually address social determinants of health and so forth. So, but we can talk more about that later. And we work with a variety of national and local partners in the work that we do. So I get to talk a little bit today about and what we see is not, the goal of this is not that healthcare organizations refer people in an unfunded way to already underfunded community-based organizations, but rather that community-based organizations like the Area Agencies on Aging our association represents get paid for those services, that they are under contract, that they are providing those services via a contract with a healthcare organization, whether that's a health plan or a health system and so forth. So one of the things that we do at the Business Institute is really to try to take the pulse of the extent to which those community-based organization healthcare contracting is happening around the country. We've done 2 requests for information surveys among community-based organizations, which with my last couple of minutes, I'm going to kind of really quickly walk you through what we've learned from those 2 surveys. The good news on the community-based organization front is that this paid contracting is increasing. So even just in the year between 2017 and 2018, we saw an increase in contracting. So we asked community-based organizations whether they were participating in contracts to provide services or programs on behalf or with a healthcare entity. And in 2017, 38% said yes. In 2017, 38% said yes. In 2018, over 41% said yes. That's a fairly sizable increase in just under a year. And we looked at a couple of different groups: Area Agencies on Aging, whom we represent, Centers for Independent Living, which serve persons with physical disabilities of all ages, as well as sort of the ubiquitous other community-based aging and disability organization. And we saw this contracting increase in that year among all 3 groups. So who are the most common healthcare partners? Not surprisingly, we see much more contracting within the Medicaid space than under Medicare. Although with the changes that are happening with Medicare Advantage this year and in the coming years, we believe that that's going to change. So what kinds of services are they providing under contract? At the top of the list is certainly sort of that grouping of care coordination, care management, service coordination, and so forth, and on down the line to care transitions, assessments for eligibility for long-term services and supports, as well as nutrition programs, evidence-based health promotion programs, and so on. Couple last things, really interesting developments that we also saw between 2017 and 2018. When we talk with health plans and other kinds of healthcare organizations, often we hear, you know what, we go into a state or a region of a state, we don't want to contract with dozens or hundreds of community-based organizations to serve that area. We want our contracting to be much more centrally focused. Think like independent practice associations of physicians. So we've seen an increase in community-based organizations that are doing business together as part of community-based integrated care networks. And you see that figure on the screen. In 2017, under 20% of the community-based organizations who indicated they had contracts said that they did so within networks. In 2018, that was over 30%, and we believe that number will continue to increase. High-risk, high-needs groups are targeted in these contracts, and you see this list here on the screen in terms of those with nursing facility, at risk for nursing facility placement, and so forth. And I think we're going to get to this in some of the questions. So maybe we'll hopefully could be able to leave this up on the screen, and I won't spend really much time on it. But there are a lot of challenges, as you heard from AJ, in terms of this contracting. Whether it's the fact that we don't often speak the same language in the healthcare world as we do in the world of community-based social services, or attitudes. You heard that from AJ as well, between healthcare providers toward community-based organizations, and sometimes vice versa on that, as well as integration into workflows were common challenges that we saw. But the experience can be incredibly rewarding, and not just monetarily for CBOs, in terms of funding that they can get, as well as positioning as a valuable partner to healthcare organizations in identifying and improving population health, as well as addressing social determinants of health.
Thank you, Marisa.